there. This is Peyton with Girls Gone Right. I have Brittany Parita with me tonight. She is the owner of Pump Fitness along with her husband, Xavier. She is a certified personal trainer and a nutrition specialist. Brittany, how long have you been in this industry for?
Yeah, so we have actually been in the industry for about 10 years now. For many, I'm known as, like you said, I am a certified fitness and nutrition specialist and exercise therapist. But I'm known as the women's coach because I've worked under a woman named Dr. Stacey Sims. She is out of New Zealand, and she's actually a research doctor that solely studies women's bodies and how they respond to fitness and nutrition protocols. Because obviously, if you do your research, a lot of research and studies are done on young males. So it's really cool that somebody like her is doing more studies on women. So I did take education under her and I was certified under her. So I work with women of all ages, backgrounds, and health issues they may be dealing with to create optimal training and nutrition protocols for their hormonal and overall health.
Wow, that's incredible.
Thank you.
So tell us what we are talking about tonight.
Yeah, so basically, I'm just going to go over um, everything about health and immune system function from obviously my side of things. I want to always make sure before we even begin to go over things that everybody knows I'm not a medical professional. I'm a fitness, nutrition, and health coach and consultant. I do work alongside a network of hand chosen medical professionals that I absolutely love and I'll refer out to if something is ever outside of my scope with a client. But nothing I say today is meant to treat or diagnose any illnesses or medical conditions. These are just simply recommendations from my everyday experience with clients over the past 10 years and my education and things like that on how you can boost your immune system and your health in general, and make sure that you are fighting things like COVID-19. So, just some quick stats that I kind of want to give everybody before I dive deep into this is, and these are from 2021, and super important, especially at this time. Um, Not because, there's a lot of illnesses and diseases that go around all the time, flu, everything like that. But everybody's freaked out right now. They're really, really worried about COVID-19. So, being in that position, we should obviously be worried about our health. So, right now, currently here in just the US, we have an even bigger issue on our hands than we think. And it's called obesity. And we're an extremely unhealthy country. And one of the biggest things, other than high blood pressure, high cholesterol, coronary heart disease, stroke, and the list goes on, that obesity can cause, one of the biggest things it can cause is type 2 diabetes, right? Um, Type 1 is a different ballgame, so we're not going to go over that. We're just going to stick to type 2. But it happens because insulin regulates the glucose level, which provides energy to the body's cells and tissues. So, in easier terms, the body of a person with diabetes cannot create or effectively utilize insulin to provide itself with the energy it needs. So, obesity, maintaining blood sugar levels, they go hand in hand. And this year, it was reported that 30.3 million people in the US have diabetes, and they are projecting, this is a projection, that there will be 200 million new cases of diabetes by the year 2045.
Wow,
Yeah, that's a
that's a lot.
scary number. That's a scary number. Um, and obesity and overweight people actually make up about 85% of all type 2 diabetes patients. So obese and overweight people make up about 85% of those people. And 9 out of 10 adults are actually walking around with pre-diabetes and they don't even know about it.
Wow.
So this is an issue, obviously. Um, and our bodies give us this biofeedback that we need to start understanding, being aware of, and taking action on. The body is always speaking to us, and the signals it's sending are directly and indirectly impacted by our individual lifestyle choices and the physiological consequences or rewards based on what you do that follow those lifestyle choices, right? So, most people want to be healthy. But what I see a lot of is people's idea of health is really one sided a lot of times. People think that just because you're skinny, you eat better foods than they do, or just because you lose a little bit of scale weight, that you're automatically healthy again. And sure, you can be healthier if you lose some weight, if you were overweight. But when it comes to evaluating the actual health of an individual or one of my clients, it's super important to look at lifestyle factors and biofeedback first. It's also important to tie that in with an individual's body composition, body fat, lean muscle mass, shape, etc. So I'm going to kind of go over what biofeedback factors that I typically look at with my clients, because these are all factors. So I'm going to go over biofeedback and lifestyle factors today, basically. These are all factors that if you positively impact them, it will positively impact your health and your immune system. So first biofeedback factor that I look at, sleep. Okay. How is that nighttime routine? Are we able to lay down and zonk out, or are we up with racing thoughts? Are we getting quality REM sleep, or are we up throughout the night? And are we getting 7+ hours of sleep? So right off the bat, I can tell you that sleep is absolutely going to affect your immune system. There's studies showing that people who do not get quality sleep or enough sleep will more likely get sick after being exposed to a virus like COVID-19. It can also affect how fast you recover after getting sick. The second thing I tend to look at is hunger. So your hunger can point to the satiety and nutrient density of the foods you're eating. So things like, are you waking up in the middle of the night starving? Do you go all day without eating and then get super lightheaded and foggy towards the middle of the day? Do you eat breakfast, but then an hour later feel super sweaty and nauseous? Do you get tired after a very basic meal? These are all things that can be an indication of blood sugar irregularities. Which again, we're talking blood sugar here. So I gave you that stat about diabetes and obesity. These are all issues. Recovery. Are you a chronic and extreme dieter or workout junkie, or an athlete simply that's overtraining? There's such a thing as overdoing it. And that's a totally different extreme, right? You have those sedentary people that are very extreme, being couch potatoes, and then you have the very extreme dieters and people that just go above and beyond with their workouts and never stop. So we need to find this balance, right? So is that being coupled with high amounts of lifestyle stress, lack of sleep, etc.? Obviously, recovery differs based on who you are and what your life looks like. So for someone with like a type 2 diabetes that's more sedentary, movement would be a charge for recovery that I would give them. In the case of a chronic dieter or an athlete who's overtrained, adding food in could simply be the answer for recovery. But sleep and stress in that realm of things are usually the biggest way to charge up your recovery typically. Then I go over energy. Are we having an issue waking up? What about midday? Do we hit a lull? And then at night, are we second winding it, or are we ready for bed? So these are all things that factor into cortisol and adrenal health, hormone health, which all is a domino effect in compounds. Then we have digestion. Gut health matters a lot, especially with the immune system. Are we often extremely bloated? Is that bloat hard or soft to the touch? Is that a lot of inflammation? That's what we're looking at. What about fiber intake, probiotics? Is your stomach constantly in pain or causing issues? The gut is your second brain. So much of what happens in your gut controls systems throughout the rest of your body, including that immune system. And then lastly, for biofeedback, and a big one that I always have to address with most clients is stress. So when stress responses elongate or become chronic, because, stress in your fight or flight mode is actually very normal. And it's a positive thing when it's balanced correctly. But if it's off, we can see some extreme detriments in immune function, resulting in chronic inflammation and higher risk for numerous diseases. So are you passively or actively stressed all the time? And people don't really know the differences between those two, but are you living in a constant state of fear or anxiety? What is everybody doing nowadays? Why do we have so many mental health issues? I think everybody is pretty much living in a constant state of fear and anxiety. Everybody's got a little bit now. That is actually a form of stress. And it's very easy to have that nowadays. So be aware of that. Overtraining with zero recovery and control over other biofeedback and lifestyle factors. Working out is a great stressor, but you can absolutely overdo it, and it can be an issue. So things like that. And then there's stress at work, home, and relationships. The list goes on, and just managing that stress matters so much. So those are all things that need to connect and tie into an individual's body composition along with age in order to determine their baseline and health risk factors. One big one that we have a direct metric on at Pump because of our 3D body analysis scanner with our clients is cardiovascular risk factors. We always look at that. And just to mix, you wonder how many, and I'm air quoting here, healthy individuals dying of COVID have these like underlying risk factors and health issues that aren't being looked at. We may think someone is healthy by looking at them from the outside or just a simple annual blood panel, but are they really living a healthy lifestyle? And do they have underlying risk factors that haven't been addressed or looked at? That's something I always look at. And it's just something to wrap our minds around and think about. You're able to critically think and use your own logic and think for yourself. So that's one thing, they say healthy people are in the hospitals and healthy people are getting this. But what's healthy? What's a definition of healthy to a person, right?
Yeah, I definitely think that like health right now, like the way people define it is just so like there's so many different ends of the spectrum. Like one person may think that like they aren't fat, so they must be healthy. And then there's just so many ways to define that. And I think that's like something that we lack in our country is how to educate people on what being healthy actually is and how to get there, what the path looks like everything that you just discussed. I feel like a lot of people are just missing that information in their life.
Yeah, absolutely. I feel like we're definitely missing the mark on what we consider healthy nowadays. It's very interesting. It's almost like we forgot what we actually know, and all we know is one lane of things nowadays. So but obviously from here, we go on to determine a protocol for fitness, daily movement, hydration, nutrition, and filling in your gaps, the supplementation. These are things you can simply choose to invest in and do for yourself, aside from controlling those basic biofeedback markers that is only going to positively enhance your health and body composition. I mean, these are necessities, COVID or not. If you want to live a healthy, happy, and long life, you are doing these things. So I'm going to kind of go over these lifestyle factors real quickly for you if you don't already know that you should be doing this, which I feel like everybody should, but you'd be surprised. Fitness and movement. You want to be with your fitness well-rounded. So especially when it comes to fighting something like COVID. And I know this firsthand because I had it, and we'll kind of get to that later in the conversation. But strength training matters, cardio matters, it all matters. Don't limit yourself to just one thing. But I strongly believe that strength training and then your daily NEAT, non-exercise activity thermogenesis goals, which that is basically anything outside of planned workouts that you do to simply move your body, like daily steps. I think those two things are very, very underrated and not talked about enough for health factors and attaining the goals that you have for yourself. Those are two things that we really, really hone in on because they are so important. I mean, just simply getting outside to walk and take steps is so important, goes such a long way. So I definitely urge people to do that and add that in whenever they can get up and move. And then we have, hydration, obviously a big one that so many people are missing the mark on. Every time I ask someone if they're drinking water, they literally look at me with like that uh-oh face because nobody is ever drinking enough water. So you want to be getting 90 to 120 ounces of water every day, typically, is what I'll give people. There's a slew of benefits, of course, with drinking water, but your body needs proper hydration to function properly in all facets, including immune function. So, hydration is key. Nutrition, quality nutrition. Do you need to get upset and all out of whack about a birthday cake or slice of pizza for dinner one night out of the week? No. Okay. Or here and there? No. But the majority of the time, people continue those behaviors into the next meal, which turns into the next day, which turns into a month. And then you're looking back and you're 2 years out of shape, gained a bunch of weight, and you're wondering what happened. Okay. So instead, enjoy a meal with no regrets or worries, eating outside of, the healthy nutrient dense foods that you typically eat, and then get right back on top of eating a healthier, more nutrient dense food source. I could jump down a rabbit hole with all of this with macronutrients, calories, protein, carbs, and fats, and then micronutrients, potassium, the sodium levels, fiber, etc. But that's honestly a totally different discussion because there is so much that goes into that. But the best thing you can do for yourself, immune system wise, is just two things. Cut down on alcohol as much as possible, choosing lighter options when you do drink, because we're going to drink, we're going to enjoy our lives. I'm totally about sustainability, maintainability with your nutrition. But choosing options like for me, I pick a blue agave tequila is really actually good for your gut health. And a lot of people don't know that. Okay.
I love tequila.
Yeah. And blue agave is awesome for you. And not a lot of people know that. And then, I stick with clear liquors a lot. So I'll do Tito's, which is a gluten-free vodka. And then I'll just have, sometimes here and there, I'll make a little mule out of it. But usually I just do a vodka tonic with like a lime or a lemon. And then every now and again, your red wine also has great health benefits. So, picking those lighter options, not going for the heavy wheat beers and the dark liquors or the really sugary drinks that are going to add up a lot in calories, macros, and put the weight on. So, and then eating healthy, more nutrient dense foods most of the time. And again, when you do have an event or a day where you do go off track a bit and splurge, don't stress it, just get right back into that rhythm. And that is really a game changer for a lot of the clients I work with. A lot of people feel like they have to, it's extremes, right? So they feel like if they go off, well, I'm already off. So I guess I'm just going to keep eating pizza. And I guess I'm just going to keep eating this. But that's not what you should do. You've got to flip that mindset. And it's a mindset that you have to get into, is that, you know what, I can be healthy and I can eat these quality, nutrient dense foods, but I can also enjoy myself from time to time. And it's going to be okay, because most of the time I eat very well and I work out and I do all the things that I need to do to take care of myself. That's a healthy relationship with food, and that's a healthy lifestyle. And then lastly, supplementation. So you're going to need to fill in the gaps in your nutrition with some basic supplementation that you're just unable to get from the food that you're eating, especially if you're in a deficit, eating less calories to lose some weight. The thing is, think about it. If you're in a deficit, you're trying to lose weight, you're eating less food, you're not getting as many nutrients in, you're going to need to basic supplement yourself. So essential supplements. I typically tell people to just start with a basic greens powder for gut health and like an extra serving of greens. Then I'll tell them a quality clinically dosed multivitamin and fish oil supplement, just starting out. And you can fill in the gaps of where you have vitamin deficiencies and otherwise as you go, and you kind of figure those things out. But just starting with essential vitamins is so important. And then if you're obviously not meeting your protein goal, which protein is your number one macronutrient, especially for losing fat, gaining muscle, and just functioning overall. And that's a whole different rabbit hole I could go down, but you also want to look into a quality protein powder that can help fill in those gaps, and maybe some quality protein bars as well could help you fill in your day. There are options if you can't eat that all in meat and other, if you're vegan, it's even harder. So I personally work exclusively with First Form, which is an incredible company. I don't know, Peyton, if you know of them, but they preach freedom and they are all about standing up for our rights. And they're like an awesome company.
We love that.
Yes. They're really, really cool. Actually, the CEO of First Form is doing a freedom tour now, and he is going to work his way around the country because of everything going on. He's super passionate about it. But
that's awesome.
Yeah, it's really, really cool. It's a great company, and if anybody needs help with supplementation, I could absolutely help you get it started, or anything macro-wise, nutrient-wise. Just let me know. If you want to invest in your health and you don't know where to start, and I'm going to kind of tell everybody right now, my ID is at _Brittany Fit, BRITTNEY fit _. And you can message me anytime and ask me any questions. I will answer you. I'm all about it. So feel free to reach out. But all of this, from biofeedback factors to lifestyle factors, is what either prevents or puts you one step closer to bigger issues like hormonal dysfunction, nervous system issues, a non-existent immune response, etc., which can absolutely compound into disease and illness. It's a domino effect. So you either take care of yourself now, or you take the chance of ending up wishing you basically did it, earlier. But other than that, I know, Peyton, you have a couple questions that you want.
Yeah, so I do have a few questions for you, just so our audience can kind of just put into little notes in their head what you just said. So what can people start doing today that can help build up their immunity?
Yeah, absolutely. So quite literally, everything we just talked about. Invest your time, and if it calls for it, which it probably will, some money into your health and fitness right now. Not later, but now, or else you're going to be paying even more physically, mentally, and financially for it down the road in the not so fun way. Start working out, start getting up and moving more throughout your day. Simply stretching and getting up to just take a walk around the block and coming back is, great for yourself. Hydrating, eating nourishing foods and not over or under eating, but rather fueling for what your body needs. Supplementing where it's needed to fill in those gaps in your nutrition because you're most likely lacking something. Remembering to keep your biofeedback markers in check, that sleep, the stress, the digestion, the energy, the recovery, the hunger, all of these factors can help fight illness and disease if you're positively influencing and taking action on them. And if you guys need any help at all, obviously you can always reach out to me because I would love to help. This is what I do daily. But yeah, those are everything. There's no select one thing that you can do for your immune system. It's really a compound effect of everything together that really, really adds up to create either a good or a bad environment.
Okay, and then just a few more questions. So I know when COVID started, they were shutting down gyms and no one would advocate for health and wellness. It was more just like stay inside, get the vaccine, wear a mask. No one said anything about going on walks, eating right, getting healthy.
Yeah.
How do you feel about that, and why do you think that is?
Oh, how do I feel about that?
That's a tough one.
Oh, yeah. So why do I think that no one is advocating for health and wellness? Money. Why would these people in higher places advocate for something that people can do without paying big pharma or the government for it?
Exactly.
And I'm not anti or pro-vax at all. Like literally, I'm not. You should do what's best for you and your family. And I'm pro-choice. I do not believe in science and would never say that this vaccine doesn't do anything for absolutely anybody because I can't say that. But do I think there's a lot more to learn about it? Absolutely. Do I think that there's a lot up in the air with it and there are a lot of things about it not being reported or reported correctly? Call me a conspiracy theorist. But yes, I absolutely think that. Any person at any time can remove themselves from what I like to call the box, watching the same news channels, reading from the same websites that aren't being updated, following the same celebrities and politicians, etc., and go do their own digging. Because you're going to find factual science-based studies and research from both the US and outside countries who are reporting things you have unfortunately not heard that are contradicting everything you're being fed and everything you thought you knew. So money first and foremost, and then from there, people just doing what they're being told, forgetting that health means more than just a vaccination, which is really, really, really sad. I mean, I actually want to bring this to the table. These are two things that I have saved in my phone from this week. But and I love like bringing factual things to the table, honestly, that people don't see on the media because you don't see everything. It's just not transparent. So, super interesting. You're going to get a kick out of this, Peyton. But the Delaware Division of Public Health Facebook page posted a photo on October 11th, 2021, very recently, with the caption, "You would have to run 5 miles a day for a week to lose just 1 pound of fat. Hashtag getting vaccinated sounds a lot easier. Protect yourself and those you love from the hashtag Delta variant, hashtag VaxUpDE." And that's not even the best part about this. The photo posted with it says, "Remember when you gained 10 pounds from stress eating? You don't want to go back. Get vaccinated."
Oh my gosh.
That's what they put up.
And I'm sorry, who posted this?
This is the Delaware Division of Public Health Facebook page.
Public health, that is just like the opposite of health.
I literally, when I saw this, I was like, how does this even make sense?
Oh
You're
my
telling
gosh.
people, remember when you gained 10 pounds from stress eating, you don't want to go back to that. Get vaccinated. Like a vaccine is going to help stress eating. They're correlating that as one thing, which in itself should tell you how dumb this post was.
And it's just so sad because, like, people are reading this, and some people may actually go get the vaccine because they saw that.
Yeah, they think that it's crazy to me that somebody would read this and say, "Oh, I don't want to gain back that 10 pounds from stress eating. I'm going to go get vaccinated."
Yeah.
What in the world? I literally read this and I was mind blown. And I can actually send you the study. And then Forbes, I don't know if you saw this, Forbes wrote an article on October 6, 2021, under breaking news online, okay? And it was titled, "U.S. COVID-19 deaths for 2021 surpass toll from 2020." But I don't see a death toll ticker in the top corner of your TV that they had going on all of 2020 for COVID deaths. Poof, nowhere to be found anymore. You would think, wouldn't it be news to have more deaths in 10 months with a fabulous new vaccine than in all of 2020 when you didn't have a vaccine?
Wow. And that's like exactly what they don't want to be put on the news. That's what they don't want to be put on the media. They don't want anyone to actually believe this.
And it's crazy too, because I think the rest of this article for Forbes was like pro-vax and pushing it and things like that. But they had the audacity to title this, "U.S. COVID-19 deaths for 2021 surpassed toll from 2020. And people will overlook that and not even think about, well, why? Why?
Yeah. It's just sad because people, like, that there is probably majority of the population that's going to see that, and they're not going to do anything with that information. They're not going to read into it. They're not going to believe it. They're not going to like put that into like that information and reflect that into their decision. It just gets ignored.
Right. It's really crazy. But yeah, I wanted to share those two things with you because they just, I mean, those are standout, just in your face, just in my opinion, stupidity, but that's
Yeah.
just exactly what's going on out there. So, but yeah, going back to the original question, it's, money and then just people following. So it's not, we've lost our sight for actual health. And now if you don't have a vaccination, you're not healthy. So that's, what we're trying to tell people is that whether you're vaccinated or not, you need to take care of your health still. It still matters.
Well, thank you so much, Brittany. I feel like that was just like extremely beneficial for everyone that is going to be listening to this podcast. Like, there is not one, like, people can take all of that information and utilize that and put that into their lifestyle and actually just like change their life. So I think this is amazing. And thank you so much for coming on here
You're so
and
welcome.
just giving us all the information.
Absolutely. And again, if anybody has any questions, wants to ask me anything, seriously, hit me up because I am happy to help.
Yep. Well, I will go ahead and when this gets posted, we will tag Brittany. So if y'all have any questions or want some information, feel free to send Brittany a message. She is very, very informative and she would love to help. But thank you guys so much. This is Peyton with Girls Gone Right. Have a great night.